Hello everybody, welcome back to CarePlus Hub. With launch of our channel and creating some of the first reels about our ecosystem, we received overwhelming responses. And of course with that came a lot of questions. Everybody asked, well, what is CarePlus Hub? What is it that you guys do exactly? Well, I wanted to bring you back to the basics and the foundation or why CarePlus Hub came about and what are the most important pillars of why our ecosystem was designed. Our ecosystem was designed based on CMS's Agenda 2030. What is CMS looking for? And what is CMS? CMS is the organization that is a federal organization that oversees Medicare and Medicaid guidelines, rules, regulations, and of course budgets. What is Agenda 2030? Well, 2030, they're trying to create other programs to increase the fee-for-service programs as to some parts to move away, some parts to add to it. So they came out with value-based outcomes and value-based pay programs, and they're trying to implement that by 2030. The reason for that, there has been a humongous spike in seniors and geriatric patients. What we are considering is LTC at home patients, especially after COVID. During COVID, all the patients end up in facilities, nursing homes, assisted living facilities, hospitals, and a lot of families felt that they lost touch with them. A lot of families are opting in for their loved ones to stay at home and receive that love, care that their loved ones need so much, and this is who we are the most passionate about, to receive at home. During that time, we saw a 13% uptick in diagnosis mismanagement. We saw 43% uptick in opioids death in geriatric patients, especially the ones that are LTC at home, the ones that are receiving their medications at home and do not have any kind of guidelines. We saw a 9% month over month emergency situation increases, and we are seeing an 8% increase on caregivers fatigue. The whole point of CMS was we have to create better value outcomes programs. This is how CarePlus Hub was created. What is value-based? Basically, what is value-based is what CarePlus Hub is trying to support the providers, the patients, to create those key performance indicators. As we gather the data from the patient, as we create a system to help them, to educate them for their medications. We help them and provide the system to monitor and provide live data from medical devices as technology can give us the support now. So we see the data live from the pulsometer. If Mr. Brown is not doing well and his oxygen levels are constantly dropping, we can engage. Everything that all these reports are talking about, we have to create better outcomes. And this is where CarePlus Hub comes in to support these organizations and support these patients at home to create better outcomes, to reduce hospitalizations, to increase their care navigation skills. Because with the new day of age of healthcare, seniors, geriatric patients with 3 or more comorbidities are having a hard time navigating the patient app, the telehealth appointments, or scheduling or navigating the confusing healthcare systems that are currently out there right now. Sometimes I'm having a hard time to understand what my specialist wants to compare to what my family doctor wants or what my analytics looks like from a blood test. CarePlus Hub helps the senior patient, the family member, the caregiver, the provider, to give them simple solutions, to create them simple analytics. We are not a provider. We are a care navigator. We assist the companies and the patients to create better outcome values. From us having many meetings now with leading providers and leading managed care operators, we are moving towards the new era, the new chapter in long-term care at home patient providing services. We have to be all on the same page to create better outcomes, to reduce hospitalizations, to increase key performance indicators, to have better outcomes in comparison to the diagnosis of these patients that are at home, to create better goals, managing goals for them to achieve in that. And we create that we alleviate that gap in that services, that a lot of confusion comes in place. So we would love to have an opportunity to meet with the directors, to have the opportunity to build those programs that will create better value in your companies, and for your companies to be the region top providers, to be them top indicators in their managed care operators or in their networks. So we are all looking forward working with you in many different states. Please contact us and welcome aboard.